I treated a patient recently with Parkinson's. His life was affected by Parkinson's disease, not only because it meant that he could no longer work as a flight nurse, but he couldn't do some of the things in his everyday life that brought him joy, like walking his dogs. The surgery we used to do for Parkinson's disease is the surgery that Michael J. Fox had, for example, where we burn a spot in the brain to try to interrupt some of the abnormal brain rhythms that occur in Parkinson's disease. And we think that Parkinson's relates to a loss of cells in the brain that produce a substance called dopamine. And as those cells die, patients have these movement symptoms, and they have the other symptoms throughout the rest of their body. We learned over time that we can treat the symptoms more effectively, not by destroying or damaging part of the brain, by instead putting a stimulator in that sends little electrical impulses, kind of like a pacemaker, to try to interrupt some of those brain rhythms. And that's something called deep brain stimulation. We try to treat Parkinson's first with replacing that substance, replacing dopamine, usually with pills. And so it's patients that develop problems with dopamine therapy that traditionally we've thought about surgery, and we thought about in the case of this gentleman. Deep brain stimulation, or DBS, it gives patients more hours of function per day, an average of 4 to 5 additional hours. It means that they, in general, report a better quality of life. The most important thing from any of the surgeries that I perform is that patients feel that their quality of life has been improved.